Hi, and welcome to Tish Talks. I'm Tish. Tish Holmes, Program Director for Alzheimer's and Dementia Services of Northern Indiana, a division of Real Services, where our motto is helping people right here, right now. And we're going to continue our topic on hospice. I've got Mia Albert here from Heartland Hospice to help us with that conversation. Hi, Mia.
Hi, Tish. Good to be here.
Thank you for being here. I guess we'll just jump right in and talk a little bit about, we're learning what hospice is, that it's a type of care, but what does that mean? What's a care team? What would my team look like? I know if I'm in a hospital, I have a doctor and a nurse and things like that, but what does a hospice care team look like?
Yeah, one of the things that actually drew me to hospice as a nurse myself is that the care team actually is made up of not just a clinical support team, but also a psychosocial support team. So I love that it's just that really holistic approach to care. So every patient that's on hospice services is assigned a nurse case manager. That nurse is going to be the one coming out and making regular visits to the home. For some patients, that's 2 times a week. Some patients, that's once a day. It just depends on what their need is.
Okay.
And that nurse is going to come out very much like in the hospital or the doctor's office doing a head-to-toe assessment, really focusing on symptom management too, though. So making sure that there's not pain that's out of control, that the patient isn't short of breath and having difficulty breathing, making sure that anxiety is well controlled so there's not any discomfort on any level. Okay. The nice thing is those nurses are also on call. So our patients in hospice care have 24/7 support. So we may not move in with them or take over 24-hour care, but we're going to be available by phone 24/7 because we know a lot of times emergencies happen in the middle of the night.
Exactly.
Doctors are out of the office, and so it's nice to have someone to call because a lot of times hospice patients have decided they don't want to go back and forth to the hospital anymore. So being able to have that nurse come out for an emergency to offer them support and symptom management in the home is a huge benefit to a hospice patient.
Oh, wonderful. Okay, so a nurse is a large part and probably the starting part. Well, the doctor and the nurse is the starting part of that care team, and then who else might be on that?
Yeah, so we also have CNAs or certified nursing assistants that go into the home a couple times a week and help with bathing and personal care. They're also going to be doing skin assessments and collaborating with the nurse if they're seeing any concerns during their visits, which it's such an important part because not only are we maintaining comfort by keeping skin clean and healthy, but we're also helping maintain dignity for our hospice patients as well.
Wonderful. Dignity is very important, especially during this stage of your life.
Absolutely.
So trying to hold on and maintain that dignity.
Yeah.
Good.
So the nurses are also supported by a doctor as well as the nurse practitioner. Families can choose to keep their loved one's doctor, primary care physician involved in their care. They can also choose to use the hospice team physician as their primary care physician. So there's some flexibility and some options there, but we absolutely work with patients' primary doctors as well. Okay. We're meeting with hospice meets every other week for what we call an IDG meeting or interdisciplinary group. So they're regularly meeting with the doctor to assess care plans and make adjustments, making sure that the care plan fits what the patient and what the family needs. Okay. And then the advantage to having a nurse practitioner as part of the team is they can go out into the home and make home visits for a patient who may not be able to get out to their doctor's office anymore.
Oh, very good. Accommodating.
Yes, very, very much so. And so that's really the clinical side of what we do. And then as far as the psychosocial support, we do have social workers as part of our team. I love social workers. They not only act as an emotional support for families of helping them know what am I going to experience emotionally during these next steps in my loved one's illness, but they're also excellent resource people too of knowing what's in the community and what's available to our patients and to our families to help them be able to continue caregiving and give the extra support that they need.
Yeah, that's very important. That's the biggest thing I hear, especially catering programs to caregivers, is that they didn't know it was out there. So
absolutely. And we know the better that we take care of our caregivers, the more that they can take care of their loved ones. So it's very important that they have that support through social workers as well.
Absolutely.
Yeah. We also offer spiritual care. A lot of times they're called chaplains. I think sometimes that can be a little off-putting for people because our spiritual care can absolutely reach out to our families who may not have a faith belief as well. So for those who don't have a faith belief, it's nice to just have a person who's there to talk through life experiences, reminisce, affirm, yes, your life mattered, the things that you've done on this earth have mattered. But then for those who do have a faith belief or may be connected to a church, that's somebody that can come in and read scripture, give communion, sing hymns, pray with them, or even help connect them with their church and have their church bring out communion.
Oh, wonderful.
As well.
I love hearing the whole theme of hospice is really teamwork. It really
Yes.
is within itself, whichever provider is out there, but also with the family. So I like that's a common theme in this
Yes,
conversation.
Absolutely. We also offer bereavement support for all of our families. So for 13 months after the death of their loved one, they're going to have a grief counselor that's going to be checking in with them. Sometimes that can be as simple as a phone call. Sometimes it's a one-on-one face-to-face counseling session or helping get them connected to a support group in the community. And we do the 13 months intentionally. We're hitting first holidays without a loved one are so hard. The anniversary of their death can be a really hard day to face. And so by doing that 13 months, extending it past the year, we can make sure that we're supporting them through the anniversary of their loved one's death and making sure that they are able to navigate that and have the support that they need through that.
Oh, wonderful, wonderful.
Yeah.
I once utilized the hospice service, and that was an opportunity for me, the bereavement, and they did continually reach out to me.
Yep.
I unfortunately did not utilize it, the support group. I didn't know I was grieving until almost a year later.
Yeah.
And I burst into tears out of the blue. But that's something that I share now for support groups out there, any and everywhere. Take advantage of them because they really could help you. And I didn't know that I needed the help at the time.
Absolutely, absolutely. We also, our bereavement coordinators actually do anticipatory grief with our families as well. We also work with kids. We, have team members who often specialize working with kids too, so that we can help children in the family navigate through that grief as well.
Very good. Are there therapies or therapists?
Yeah, absolutely. So that is something that is offered through the hospice benefit as well, is those therapies. I know a lot of people think, I have to give up therapies if I'm going on a hospice, but you can work alongside. We have a contracted company that can bring in physical therapy and occupational therapy. It again goes back to dignity of helping people be able to participate in their activities of daily living. It's also a comfort measure. A lot of times just those simple exercises can help with pain, with aching joints, with aching muscles. And massage therapy is also another therapy that is offered. So obviously we know that that's a big one to help with comfort.
Oh, yes.
Yep, especially a lot of patients who are bedbound, they have a lot of back pain, and so being able to have that massage therapy is such a huge benefit to them. But also that human touch and interaction, because a lot of our patients live alone. They may not have family that's involved, and so being able to have that human touch and that human connection, I think, is such an important part of massage therapy as well.
Wonderful. Well, Mia, thank you so much. You've given me what a hospice team can look like for those who may be looking for hospice and still wondering and not quite sure what they do, and again helping to dispel some of the myths, like there was a time that I thought you couldn't have therapy with hospice and things like that. So thank you so much for helping to enlighten us out there, and thanks for
welcome.
coming.
Thank you.
And again, that's Mia Albert with Heartland Hospice, and thank you, Mia, and thank you guys for watching.